Good afternoon. Thank you all for being here with us today on this Thursday afternoon. We have Dr. Dobbs and Director Michelle back with us this afternoon. We're glad to have you back. I know you both were on the road yesterday, meeting with fellow Mississippians, getting them up to date and working through issues, and I sincerely appreciate your efforts both here in the capital city, in this building across the street from our beautiful capital, but also as you go out and actually meet with our constituents and meet with our elected leaders so that we're all on the same page. That's one of the things that's critically important at this phase of the fight against this virus, is that we are all working together, pulling in the same direction for the common good. We know that this virus still exists in many of our communities, but we also know that in many respects the curve is flattening. We have seen a lot of disparity from one day to the next in terms of total number of cases. As you know, from the last week, 3 out of the last 4 days, we've had less than 200 cases. And then today, not surprisingly, it seems like on Thursdays and Fridays, we tend to have an uptick in the number of tests that are reported positive, and that was certainly the case today. But if you look at a 3 to 5 day rolling average, we have continued to stay relatively consistent. That is not to say that things are improving drastically, but also that is not to say that things are getting significantly worse. It is getting worse in certain areas than it is in others. That's the reason that we have implemented these 7 counties specific plans, and we'll be able to continue to talk about that should that interest you in the question and answer. I also wanted to give the people of Mississippi an update on what the deal was that was worked out with the legislature for this first round of CARES Act assistance for small businesses. You have heard me talk about our priorities with respect to the CARES Act, and I appreciate the legislative leadership and the work that they have done over the last several weeks to get us to this point. I must have said it at least 100 different ways, but it's really unfair that this nationwide crisis and the cost of it is being carried by those small businesses and their employees. Again, Wall Street is going to be just fine. Main Street is where my concern is. Main Street, Mississippi, in places like New Albany, and places like Magee, places like Amory, and places like the Mississippi Delta. The big global companies are going to be fine. The small businesses that are Mississippi born and Mississippi bred are where we should focus our efforts. Here's what was in the first deal. $300 million for small businesses to support their employees and to cover costs from being shut down. It's broken down into 2 main sections. There's one immediate source of stabilization that most businesses that were interrupted should be able to get. That's direct payments directly to small businesses. It will involve as little paperwork as possible. We still have to ensure that we comply with federal Treasury guidelines. We still have to ensure that we comply with the law as it was passed by the state legislature, but the goal will be to get these dollars out as quickly as possible. Then small businesses can get additional money through what we're calling the Back to Business Fund. You can get up to $25,000 to reimburse the costs that you've incurred and the damage that has been done during this time. Admittedly, it is for small businesses, not big ones. You have to have less than 50 employees, says the law. For the first 21 days of the program, it's reserved for businesses that did not get Paycheck Protection Program funds through the federal government. We have to fill in the gaps. It also protects a certain amount of the funds for minority-owned businesses at the front end because we know that community has been hardest hit by the virus. We'll get a final review of the bill done in the coming days before we sign it, and then get to work on the application you'll have to fill out. Then we'll get the funds out as quickly as possible now that the legislature has debated it and voted on it, this first part of the CARES Act funding. There is a lot more money to get out and not much time to do it, but I'm glad that we were able to get this done. My priority from day one has been the quick release of these funds to get it back to the people who need it. We have to follow the rules that Treasury has set forth, and we have to follow the laws as they are passed by the legislature. But I'm hopeful that it can happen soon. It will never happen as quick as I'd like, but I know that we're through the first phase of the negotiating process. I'm grateful to everyone who got involved in this for working together to get this done for the people of Mississippi. At this time, I want to remind you that we are going to have a little bit of an opportunity to make people feel good about themselves, particularly those that are in the class of 2020. I know that this senior year did not end for our high school seniors in the manner in which they wanted it to. It did not end in the manner in which I wanted it to. But Saturday at 10 a.m., we're going to have an online graduation service for you. So I want you to go to my Facebook page, tune in for more information. You're going to have the opportunity to pass along your name so that I can actually read it out, congratulate you. Tell me if you were the valedictorian. Tell me if you were the salutatorian. Tell me what school you're from. Get your friends and your neighbors to do the same. I got great joy and great pleasure for weeks on end during our shelter-in-place order, wishing Mississippians a happy birthday. I will tell you Saturday morning at 10, I'm going to have a great big old smile on my face because I know things have been difficult for our senior class. They will never forget their senior year. I will never forget the sacrifices that you've made, and I look forward to bringing maybe just one or two or maybe more people a little bit of joy on Saturday morning. With that, I'm going to turn it over to Dr. Dobbs and let him talk about our current COVID situation.
Thank you very much, Governor. As an update for today, as you know, we are reporting 393 new cases today and sadly 15 additional deaths. That brings our total case count up to 10,483 and 480 deaths. Among our cases, 54% are African American, and of our deaths, 58% are African American. Our reported hospitalization rate is now down to 17.3% of total cases, indicating that we're identifying additional people with a less severe illness. We have documented 6,268 patients who have recovered thus far and have tested 105,326 Mississippians to date. If we look at what we've done so far, I would like to say, in regard to flattening the curve, that we have been successful in that effort. And all of the sacrifice that we've made up to this point has been worth it because the number of cases that we have are much diminished compared to where they would have been otherwise. So part of that is to reiterate how important it is not to lose the ground we've gained. Make sure that when we're in public and doing things as we get back to some sort of normalcy, that we follow the social distancing guidelines, that we wear our masks in public, that we don't go out if we don't need to. If it's something that's not extremely important to you, please, you can let it go. And certainly with social events and things where around groups of people, don't go if you don't need to, but if you have to, please practice social distancing, wear a mask, use hand hygiene. We don't want to lose the progress that we've made. We want to have a nice summer. There has been some interest in the pediatric multisystem inflammatory syndrome. It's a new condition that's similar to Kawasaki's disease, where we see basically an immune reaction some period of time after the coronavirus has caused an infection in children. It's primarily in kids less than 5 years of age. We will start collecting case reports from physicians. It's becoming a reportable condition now in Mississippi that physicians need to tell us so we can then report it on to CDC. And thus far, we have one suspected case of this syndrome that we're looking into right now. Nursing home testing, long-term care. We are going to aggressively ramp up our testing of long-term care settings at nursing homes throughout the state of Mississippi. We anticipate that through a collection of efforts, including our teams going and collecting specimens or the nursing homes themselves, collecting them and submitting us the data, within a couple of weeks, within 2 weeks, having tested every single nursing home resident and every single employee to give us an understanding of how we can help each individual nursing home prevent additional transmission within that vulnerable population. And as far as testing goes, we want to encourage people to get testing if they have any symptoms of coronavirus or if they think they might have been exposed. So tomorrow there will be free drive-through testing events in Quitman and North Carrollton. On Saturday, Waynesboro and Corinth, and next Monday, Okolona. Additional ones will be added as time goes on, so please look. You can use the C-Spire app, or you can call 601-496-7200 to schedule an appointment. Additionally, on our website, we have over 200 clinics throughout the state that are testing for coronavirus. So you can go on msdh.com and find a location where you can get tested if needed. Thank you, Governor.
Thank you, Dr. Dobbs. As a reminder, we have relaxed the requirement for getting tests generally. When we began this process, we were very clear. We wanted to test those healthcare workers, those in long-term care facilities, those who were most vulnerable, and primarily those who had symptoms. As we have ramped up testing, we've done well over 100,000 tests throughout Mississippi, which means we're headed towards having tested almost 4% of our population. We had a goal of testing at least 2% of our population in the month of May. We are headed in that direction. We have also switched gears a little bit and moved towards this goal of testing everyone in long-term care facilities. The reason for that is it has become more and more evident when you look at our total number of deaths. At least 85% and almost 90% of them are in individuals who are over the age of 60. That does not mean that it cannot cause serious harm and damage to those under the age of 60, particularly those who have pre-existing conditions. But it is no doubt that this virus is particularly cruel to those in those vulnerable categories. It's the reason we still have a shelter-in-place order in place statewide for those individuals who are in that vulnerable category. Please be careful, be safe, take care of yourselves. But if you are in doubt, if you think you have the coronavirus, please get tested. We are not in the same position we were 5-6 weeks ago with respect to that. We do encourage you that if you think you've got the virus or you think you need to be tested, then please do so. At this time, I'm going to turn it over to Director Michelle. Director Michelle, welcome back, and the floor is yours.
Thank you, Governor. Good to be back. Just want to first mention a little update on our PPE deliveries. The National Guard, in conjunction with Mississippi Department of Health and MEMA, continue to work hard in getting our PPE out. Yesterday, there were 50 Tier 1 facilities that received deliveries for PPE. In addition, the District 5 point of distribution was delivered to. Today, they are out working all the pod deliveries to the 82 counties and the Band of Choctaw Indians, less District 5, and then also doing District 5 Tier 1 facilities today. I want to talk a little bit about the Battelle Critical Care Decontamination System. You heard us mention it earlier, about a week ago, but that system is up and operational at the Mississippi State Fairgrounds. That system was put into place to decontaminate and sterilize N95 masks. We currently have 27 facilities that have registered to use that. Currently, we've not had any operations or any masks being brought there. And I just want to take a second to remind everyone, if you are a healthcare or long-term care facility, you can go online and register at battelle.org. That's battelle.org/decon, or you can go to our MEMA website at msema.org and go to the COVID-19 drop-down menu to resources and follow the tutorial to register. It's very easy. This is a free service. And it also includes transportation. You go online, you register, you'll be given a 3-digit code for which you to mark your bags. Then you'll go online and click and choose your delivery provider. In this case, I think in the most cases, it's going to be FedEx. They will come based on your schedule, pick those masks up, deliver them to the decon site, and then they will be delivered back to you once they are deconned. This is a great way to extend the life of your N95 mask while we are working to continue to build up our PPE stockpile. So again, take advantage of that facility. I know that Mississippi Department of Health will be having phone calls tomorrow with the healthcare facilities and long-term care facilities and putting this out again, but I want to take an opportunity to identify this resource that healthcare and long-term care facilities have. Not going to belabor the issue on decoration update, but I would like to point out two things. First of all, those victims of the Easter tornado that occurred on April the 12th will have until June the 15th to apply for Small Business Administration benefits. Depending on what county you reside in and location to, the damage will depend upon the benefits that you'll be available to. There is information that is also on our website about those benefits and how to apply for those benefits. So if you'll go again to msema.org, to our website, and go to news, as a news release was put out today, and we'll be putting out additional information about your county and what benefits you'll be eligible for there. And then finally, our 6 disaster assistance centers that we opened up in Walthall, Lawrence, Jasper, Clark, Panola, and Grenada County have been working. We've not had a lot of throughput in those facilities, but that's good news, good news. It's good news because people are going online and using the toll-free number by which to register, which is exactly what we encourage to maintain social distancing. But the other good news is that for those that don't have access to internet and the phone, are able to go to these facilities and make their applications. As of today, we're upwards over just over 1,900 applications for individual assistance. So continue to utilize that resource as you can. And then finally, hurricane season, we continue to monitor that system off the coast of Florida, north of the Bahamas. We don't feel like that's going to be a threat to us this time, but again, it will be our first storm. I want 2 things. First of all, remind everyone to make sure that PPE is a part of your disaster response kit in the event that you have to shelter. We want to make sure that you do have those items available for you. And then secondly, we will be messaging throughout hurricane season and recommending that people do evacuate and not utilize shelters unless you have to, because based on CDC's guidance, we will be able to shelter much fewer people this hurricane season, which means we will have to have more shelters available. So please, if you have the means and the resources, when you're issued an evacuation order, please evacuate, and let's allow those shelters available to our vulnerable population or those that don't have the means to get out. So, Governor, that's all I have for today, sir.
Well, thank you, Director Michelle, and I just want to reiterate the machine that we have set up at the Mississippi State Fairgrounds can take N95 masks that have been used and decontaminate them so as that they can be reused. This has been done in many other states around the country. Obviously, these machines, as they were initially coming off the lines, were sent to those very hot spots in New York, in Detroit. I believe the machine was actually, if I remember correctly on our White House call, was originally actually produced in the state of Ohio. So the state of Ohio got one of the machines very early on, as you would expect. But this is a service that will allow us to ensure that we do not have PPE challenges in the future, and also that we have means by which to deal with our long-term PPE issues as more and more businesses come online and their employees are using PPE and other things. And so these N95 masks can be decontaminated and reused for individuals in these hospitals, in these nursing home facilities, and in other facilities for our law enforcement officers. And we are told repeatedly by the Coronavirus Task Force that the machines work and that they are very, very safe. So with that, I'll open the floor to questions. Courtney Ann.
Looking at the legislative plan that was approved, that direct payment amount, $60 million, $2,000 payments to businesses. If I'm not mistaken, you had expressed a desire to see direct payments to both businesses and the individuals that worked in those industries. Is a payment for individuals still something that you will push for with the legislature to say not just the businesses but the individuals themselves?
Well, that's certainly something that I believe in very strongly. The legislature wanted to focus this initial plan on small businesses, and we have always said that small businesses were hurt and harmed significantly, and we know that. And so this is a step in the right direction. They did it quickly, and I appreciate that. And so now we've got to get the legislation, review it one more time just to make sure that all the I's are dotted and the T's are crossed, that every program that they have passed does in fact comply with Treasury guidelines, and then we'll get those out. But I am certainly still continue to be very interested in helping those individuals that were harmed, that perhaps were not able to get their unemployment insurance checks, for instance, or those individuals that were harmed because the government did what they thought was right to shut down certain industries for safety reasons, but these individuals got hurt at no fault of their own, and we, as state government, should step up and help those individuals. Renee.
Dave Elliott with WLX has a question. Step away. Bobby Harrison with Mississippi Today has a question. Bobby?
Yep. Hey, Governor, it sounded as if you're going to sign the bill, but if everything's okay, but that's, unless you see some unforeseen problems the way it's written or something, is that correct?
What I would say, Bobby, is obviously this is my fourth month as governor. We have set up a process whereby my policy team, my legal team, et cetera, we go through and read every single bill. We're going to go through that process over the next several days, but both many of our team members were engaged and involved in the conversations throughout the process, and so we certainly are aware in general terms what's in the bill. The two programs are very similar to the things that we've been talking about and proposed over the last several weeks, maybe over the last 3 or 4 weeks. And so, again, we're gonna let it go through the process. We've got a few days to do that, but generally speaking, these are programs that are very similar to what we've been talking about for weeks and weeks on end.
Dave Elliott, WLX, has a question back in front of the camera. Hey, Dave.
Hey, Renee, thanks so much. Governor, I guess you're about to roll your eyes because I'm going to say the C word, casino. Casino industries were hoping for an announcement regarding opening today, but I guess this small business assistance legislation kind of became the story of the day. Operators say they're 100% sure you'll approve plans for reopening tomorrow. So can you give us some kind of preview? Is Mississippi ready to open the door on gaming? Are you satisfied that all the properties are prepared, that they can bring back workers, generate enough revenue under these strict rules? And can you give us kind of a likely date?
Yes. Thank you for that question, Dave. I appreciate that. I know, much like you say that I am going to roll my eyes when you ask the question, you're going to probably roll your eyes when I answer it. As a reminder, no executive order was ever signed which shut down casinos by the governor. The Mississippi Gaming Commission, in conjunction with and in conversations with the governor, made the decision to shut down the casinos. I think they did it at the right time. They did it for the right reasons. We have been in conversations with them. They are working hard to make sure that the guidelines that they put in place are put in place in such a way where the casino industry can reopen in a safe, responsible way. I would anticipate, if I were in the gaming business in Mississippi, I wouldn't wait for a specific order to come down to start planning. I would go ahead and start planning now. In fact, I would have started planning yesterday when I mentioned that it's time to start planning. I would anticipate that there will be a potential guidelines set forth and an announcement by the Gaming Commission at some time in the very, very near future. And my anticipation would be that they will open sometime, as I have said for the last several weeks, before Memorial Day weekend, so sometime mid to late next week. Yes, sir.
Are you concerned that these funds, although they have been passed, you're waiting for a review, will not get to those business owners soon enough?
Yes, I am concerned by that. In fact, if I could send out checks today, what I would tell you is that those monies would not get to these small business owners soon enough. The fact of the matter is that they have been hurting for weeks and weeks and weeks on end. And so what we can do, all we can do is all we can do, and we are in the position that we are in today. And as soon as we can get this money out to the people of this state, we're going to do so. No questions asked. We're gonna comply with the laws as they're set forth in both federal and state law, and we're gonna do everything in our power to get these checks out as soon as possible. Yes, ma'am.
Quick question for Dr. Dobbs. Any additional information that you can give us regarding that one pediatric case, a county, or how old the child is, perhaps?
Yeah, we're not going to release those details, because it'd be too easy to identify the kid. But as we get more and more information, if we identify more cases, we'll make sure we keep you guys updated.
Taylor Vance with Daily Journal has a question. Taylor?
Thank you, Renee. Governor, I also have a question about the legislation that came out of the legislature last night. And again, just going off of sort of what you said a few moments ago, the team is heavily involved in working with several of the legislatures on the final bill. As you probably know, the Mississippi Development Authority is set to administer the overwhelming majority of the funds and oversee the application process for businesses to receive some of the funds. So have you had any conversation with MDA leaders about how they could efficiently administer these funds? And the second part of that question is in the legislation, there's $900,000 set aside for MDA to defray any costs associated with administering this legislation. So do you know how these funds will be used how those $900,000 would be used right now to administer those funds?
Well, thank you for the question. Obviously, this legislation was passed sometime late last evening. In fact, I think the House went in after midnight to table the motion and reconsider. And so those are all questions that we will be answering over the next several days as we look to the specifics in the bill. I can't give you an answer to that at this time, but as those details become more and more available, I'll let you know as soon as I know.
Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. I have a question for Dr. Dobbs about long-term care facilities. I want to make sure I'm interpreting the table listing the counties, the active outbreaks, and the cases correctly. In about 12 counties, they're currently listed as not having an outbreak, but also from about 1 to 25 cases among residents. So does that mean that MSDH considers the outbreak contained in those residents or employees with cases either recovered or passed away?
That should be correct. We certainly have a lot of long-term care settings that have had cases that no longer have additional cases, and they'll fall off the list. Without looking at it directly, I'm not sure I can precisely understand, but absolutely, homes will fall off the list after they're beyond the outbreak duration.
Governor, what kind of shape is the Mississippi Unemployment Insurance Fund in right now? It seems as though if you have more folks continuing to file and then the struggle of businesses to pay in, that it would be kind of a perfect storm for that fund to get low.
It's a great question. It's not in as good a financial shape as it was 8 weeks ago. 220,000 Mississippians have filed for unemployment assistance in the last 8 weeks. That's 220 times or 22,000% more than filed the week before we received our first case in Mississippi. The good news is, much like our rainy day fund, much like our capital expense fund, because of conservative leadership in the Mississippi legislature for the last 8 years, our unemployment trust fund was in great financial shape. We were one of the top 5 states in the nation. Again, this, I go on national news and they ask me these questions, and they're just shocked to hear the financial shape that Mississippi was in before we got into this mess. Now, this mess is going to change that, but that's the reason that we have been so adamant about filling up our trust fund on our unemployment trust fund. It's the reason we've been so adamant to fill up our rainy day fund is so that we would be prepared for times like this. The fact is, while there are 220,000 people that have filed unemployment insurance over the last 8 weeks, it is still true that a majority of the weekly benefits, which are well in excess of $70-80 million a week, the majority of those dollars are still being paid by the feds through the CARES Act. It is my opinion that as we continue to work with our legislative leaders, that we should look to refill the unemployment trust fund with some of the CARES Act funds. I believe that they clearly comply. Just remember, the unemployment trust fund is actually filled by taxes on small businesses. And so if we don't use CARES Act funds to refill it, then the taxes on small businesses are going to go up to refill it. And this is the absolute worst time for our small businesses to get their taxes increased, because their revenues are down. They're having a hard time with getting employees. They're having a hard time with sales. The last thing we need to do is raise their taxes. And so I think as we progress through the process, that's another area that the legislature will look to spend CARES Act monies, and I think that they should. Yes, sir.
Some recommendations were made to you from the committee you set up, headed by Victor Mayor George Flags. Is there any timeline to make a decision on which of those 3 people you will lead the Department of Corrections?
Oh, Department of Corrections, yes. Yes, so they have gone through the process. They've done interviews. They're making a recommendation to me and may have already made it. If they have, it hadn't gotten to my desk. But that's no reflection on anyone other than me. It's just I have been very focused on COVID-19 and in the last several days very focused on getting this money out to small business owners. But my time frame with respect to the Department of Correction is as soon as humanly possible, and so I would hope to be able to do something certainly this month.
Alyssa with Clearing Ledger has a question. Alyssa?
Thank you, Renee. Governor, my question is, how involved was your office in securing PPE in the early stages of the state's response to the pandemic? We talked to one medical supply company based in Mississippi that said your office, not MEMA, reached out directly to them. I was just wondering, what was your role in that process and how did it work?
Yeah, thank you for that question. As you know, in the early days of this crisis, PPE was an absolute challenge. It was an absolute challenge for Mississippi, and it was an absolute challenge for every other state in the nation. And quite frankly, it was and has been and continues to be an absolute challenge for every country in the world. The vast majority of PPE is actually produced in the nation of China, and because of that, we found ourselves in a position in which we had to work very, very hard to find PPE. I tasked not only the Mississippi Emergency Management Agency as well as the Mississippi Department of Health, but also we tasked any and everyone that had contacts to reach out to try to find PPE and funnel them through the procurement professionals at the Mississippi Emergency Management Agency. Every purchase that was made, to my knowledge, was made either through the procurement professionals at MEMA or perhaps there were procurement professionals at the Department of Health that were engaged as well, and perhaps they were even intertwined. I'm not really sure, but we tried to reach out and find anyone that could help us and put them in touch with our procurement professionals at the Mississippi Emergency Management Agency.
Emily with AP has a question. Emily?
Thank you. My question is for Dr. Dobbs. Dr. Dobbs, you have said at a couple of news conferences that you will not release that the Department of Health will not release the names of long-term care facilities where people have tested positive for the coronavirus. I wanted to ask you about the justification for that, given that significant public resources are used by the Division of Medicaid that pays for a lot of patients in even privately run nursing homes. And there are also public resources used by the Department of Health to inspect nursing homes. Given the involvement of public money, does the public not have a right to know the information?
For years, and ever since I've been at the Department of Health, we've recognized the real potential danger of identifying nursing homes in outbreaks. In other states, we've seen adverse events where people were identified, stigmatized, and even the centers were stigmatized. If a center gets stigmatized, there's difficulty finding staff, and then there is a possibility of undermining the integrity of the care in those areas. And we do know very well that whenever we have scenarios where people have to move for whatever reason because of understaffing, there are adverse events that happen to the residents. I understand your interest in this, but it's been a long-standing. Many states do not release it either. I know many do, but many do not. And we still feel like it's the best interest of the residents in long-term care that we respect that privacy.
Dave with WLX has another question. Dave?
Governor, it's becoming a familiar refrain all around the state. Cities in every corner of Mississippi are feeling the pain. Biloxi losing millions of dollars a month. Gulfport Mayor Billy Hughes said the state's second largest city is shedding $1 million a month. We're hearing things like furloughs, salary reductions, layoffs. The Municipal League wants a change in the restrictions on CARES Act money. I know that's a federal matter, but is there anything you can say to cities right now who are really up against it and thinking they may have to take drastic measures?
Yes, what I would say, and I've had almost weekly conference calls with our Mississippi Municipal League, and as you know, Gulfport Mayor Hughes is the current chairman of the Municipal League, and these local leaders in our state have done phenomenal work during this virus. I think some of them have probably gone a little bit too far in some of their orders, but they certainly have the right to do so, and if that's what their communities want, then so be it. But there is no question that revenues are being affected because cities are funded by property taxes and they are funded by sales tax diversions from the state. They depend on those sales tax diversions, and the reality is when people are locked up in their home or choosing not to go out and go to restaurants, then that significantly impacts the budgets of cities. And so I have said from this podium that I do believe that we ought to make sure that we have a program in place such that our cities can get monies. I am supportive of that effort. I think the cities need to certainly talk to their legislators regarding that. There is guidance with the CARES Act that if you can justify that emergency responders, those in police and fire and perhaps deputy sheriffs even, so it's not just cities, it's counties as well, have spent the bulk of their time over the last 2 months working on COVID-19 related work, that we can use CARES Act dollars to reimburse the cities for that. I am for that. I am for utilizing those monies to get them out to our local police, our local firemen, because it's those emergency first responders that run into the danger, not away from it. And I believe to the extent we can help those individuals, we should be doing so.
Thank you, Governor. Thank you, Renee. My question is, I know that you received a bill last night that the legislature passed on your desk, and that most of that, well, I'm not necessarily sure how much. I know 300 from what I read, at least, it would be given to the small businesses. Where is the rest of the money going to be divided among, if you have some stay in that?
Well, thank you, Hunter, for your question. Just a minor technical correction. The bill actually, I believe, will be delivered to me today. That is important, not to the people of Mississippi, but it is important in terms of where we go from here. This $300 million is a program for small businesses. The legislature has adjourned, they have recessed today and will come back sometime in the future. I hope that's as soon as possible. I have outlined a number of programs that I believe that we need to invest in. I believe very strongly that we need to use these CARES Act dollars not just to spend them, but to invest in our people, to invest in those small businesses that have made a sacrifice during this, not through no fault of their own, but because their government has shut them down. And so ultimately we will work with the legislature to allocate the additional $950 million that was allocated and appropriated by the federal government in CARES Act funds, and we look forward to working with them to do that.
Bobby of Mississippi Today has another question. Bobby?
Governor, along those same lines, I was just curious your thoughts about providing money to individuals who lost their jobs. I mean, are you talking about individuals of small businesses who lost their jobs, or just all people who lost their jobs in the state? I was thinking about the casino. I mean, that could, I mean, it's a lot of money, but checks to everyone that lost their jobs could turn to a lot of money, and that pot of money, as big as it is going to get pretty small pretty quickly. So I mean, who are you talking about sending checks, you'd like to send checks to who lost their jobs? Individual and small businesses or everyone?
Well, one of the programs that I talked about, the potential of utilizing were our, for instance, our barbers and our salon operators. Many of those were not able to either receive the PPP program, nor were they able to receive unemployment benefits. And so I think you've got to make sure that we are getting monies in the hands of those who are most affected, that have not been helped by other programs. But there are many barbers, there are many salon operators that, while they may rent space at a barber shop, they're still a small business owner because they're a one-person shop that gets paid based upon how much work that they do. And so that's one example of one of the things that I had proposed. Now, in the plan that passed earlier today, there is no doubt that our salon shop owners and our barber shop owners will be eligible. That's a good step. As I told you, there's about 7,500 of them statewide. I think that's a very good step for those individuals. But again, if the government shuts you down as a business, then these CARES Act monies are uniquely well qualified to get them in the hands of those small business owners. The other thing that I would tell you is there are individuals and there are businesses that, for instance, going forward are going to have to change their business model. If you are a restaurant, for instance, and you have 6 or 8 or 10 employees, well, you're going to have to provide masks for those 6 or 8 or 10 employees, and you're probably going to have to provide gloves for them. And so these are additional expenses that were not in your original business model, because no one really imagined, at least I didn't, 6 months ago, that we'd be here talking about this pandemic day after day after day. But we are where we are, and we want to work to expeditiously get money in the hands of individuals, just like we've been working to get the unemployment compensation to those individuals, the pandemic unemployment assistance to those individuals, and we want to overlay those who have not been helped to the extent possible.
Alyssa with Clearing Ledger has another question. Alyssa?
Thank you again. Governor, earlier you talked about relaxing the general requirements for getting tested for COVID-19. I was wondering, will requirements for getting tested be relaxed also for incarcerated individuals in Mississippi? MDOC policy says that someone has to have a fever as well as show respiratory symptoms in order to qualify to get tested. And I've spoken to inmates that say maybe they have some symptoms, but not the ones that are required, and so they're not able to get tests.
Right. We're looking to, as we build up capacity on testing, we're looking to increase testing for as many Mississippians as we possibly can. That's certainly an area that we will continue to monitor and continue to look at. We have seen that we have had a few cases in our prison system, but our decision very, very early on to cease all inmate transfers, our decision very early on at the department to cease all visitation to inmates has helped us make tremendous progress there. But again, this is a situation that changes daily, and we're going to continue to monitor it, and we're going to be prepared to make any adjustments that need to be made to protect the well-being of our inmates, while at the same time protecting the well-being of those who are not incarcerated. We believe that we have a duty to protect both.
Dave with WLOX has another question. Dave?
Thanks, Renee. Governor, the travel and tourism industry has been gutted by this pandemic, not just huge down here on the coast, but Vicksburg, Natchez, even Jackson. I'm told what's being called the Tourism Recovery Fund using CARES Act money is in the works, and that you have told tourism leaders you support it. Do you have any idea how that fund might be used to help get the industry back on its feet?
Yes, thank you, Dave. I actually had a call earlier this morning with hundreds of executives of tourism and visitors bureaus throughout Mississippi. They have a great association that does great work. Obviously, Visit Mississippi is housed within the Mississippi Development Authority, and I do support spending some CARES Act funds within the tourism industry. It is a critically important industry in our state, and as you can imagine, there are a lot of industries that have been harmed because of COVID-19, but none significantly more so than our tourism industry. Whether you're a bed and breakfast in Natchez or a major casino on the coast, the shutdown has significantly changed your business outlook. It has significantly changed your revenue, and it has significantly impacted your employees. When we think about 220,000 employees that have been affected, I will tell you, I think at least 50,000 of them are in the tourism industry, maybe more. And so that is an area that I am supportive of utilizing CARES Act funds for their benefit. We're going to continue to work to try to make that happen. I think it's important. We have got to get our tourism industry back as soon as possible. I will tell you, I believe in my heart that we as a state were poised to have an additional jump in tourism this year. We had approximately 25 million visitors to Mississippi last year, and I think if we are smart, we can grow. And I think this is one of the areas where we have got to develop a long-term plan to grow our tourism, not from the level where it currently sits, but we've got to develop a plan to grow our tourism industry from where we were pre-COVID-19. We have to think big. This is an opportunity for Mississippi to realize that we can compete with anyone, anywhere in the world, particularly when it comes to tourism, because we have so many attractions in so many different areas of our state. And I will tell you, it is my goal to make sure that we are getting resources in a way that our tourism industry can come back, it can flourish, and we can encourage and incentivize even more non-Mississippians to come to our state and see the great things that are going on, like the new tourism attractions on the Mississippi Gulf Coast, the quaint small towns in the Mississippi Delta, the blues museums, the blues and opportunities that exist there, the fact that Elvis Presley was born and raised in his early years in the great city of Tupelo in Lee County. We have so many attractions, and we've got to be successful, because if we ever convince somebody to come to Mississippi once, they tend to love what they see, and then they go back to their communities and they talk about how nice our people are and how hospitable we are. And so we've got to use this not to sit back and feel sorry for ourselves, but we've got to use this as an example and as an opportunity to go out and set our sights even higher, know that we as Mississippians can compete with anyone, anywhere in the world, and that's true in the tourism space just like it's true in every other space that exists out there.
Bobby with Mississippi Today has another question. Bobby?
Governor, what would you like to be the next issue the legislature tackles with these monies? Well, I mean, what's the next priority?
Well, thank you, Bobby, and I'm not prepared today to tell you what the very next priority is. I've outlined 4 or 5 priorities. I want to sit down with our legislative leaders, and hopefully we'll work together to determine what that next priority is. There's a number of different opportunities for us, and we think that, and I've talked about 3 or 4 of them here today. And what I will tell you is, much like I have told you that there is no non-essential business in our state, that every single business that operates is essential to the individual or the people who own it. And just like every single business is essential to the employees who depend on their paycheck to put food on their table. When we talk about priorities in terms of what's next, what I would tell you is we're talking about very small degrees. We have a lot of priorities that we need to be talking about. It's not one priority is our next priority. We've got 5 or 6 priorities that we've got to work on simultaneously, because we've got to get these monies out as quickly as humanly possible.
Hunter with the Gazebo Gazette has another question. Hunter?
Thank you, Renee. Thank you, Governor. One last question for you guys. I know that last week the White House, President Trump, pretty much got behind the seafood industry and really claimed being one of the essentials, and put together an executive order to show that they were essential needs. My question to you, Governor, is there anything that you could, I guess, fight for in this industry, you know, such as, other things as such to help promote the seafood industry similarly to the White House?
Absolutely, Hunter. Thank you for that question. I believe that President Trump has heard our calls for support for our seafood industry in Mississippi. It is critically important. The people of Mississippi, particularly on the Mississippi Gulf Coast, there are literally thousands and thousands of them that make their living off of what's underneath the sea in the Gulf of Mexico. And what I want you to know is that I'm going to continue to fight every single day for those individuals that are in the industry, for those shrimpers, for those folks who are boat captains. They have had a tough go of it for a number of years. I mean, between the fact that we've had the BP oil spill, followed by the opening of the Bonnie Carey and the salinity of the water coming into question, one of the things that we need to do, we need to take this opportunity to remind the American people that seafood out of the Gulf of Mexico is safe and it is delicious. And that's one of the things that I think we as a state need to market more, and we need to focus on, perhaps partnering with our allies from various states in the Gulf Coast region.
Dave with WLOX has another question. Dave?
On the record.
Dave?
Thanks, Renee. I was going to be finished, but I've just been handed a message that the Gaming Commission has now determined that casinos will, according to their plan, open on May 21st at 8 a.m. Governor, what needs to be done from your perspective now to go ahead and finalize that and make that official?
If the Gaming Commission has released their decision, it is final and it is official. Is that good enough? Any other questions? Seeing none, thank you all for being here.
When do you plan to reopen DMV offices?
We actually signed an order earlier today which outlines that state agencies need to start developing plans to bring people back. I would say DMV offices fit in that category. Dr. Dobbs and I, his team, and I will sit down and discuss these state offices that are open to the public. What measures can we put in place to ensure that we protect not only our employees but also protect the public? We don't have a specific date to open the DMV offices, but that is something that we will have conversations of over the course of the next several days and weeks. No question that as each of you have these questions that are being asked of you, these are conversations that we are having internally every single day. And as you can imagine, there are more questions than answers almost every single day. And so we continue to work to try to find ways to set out guidelines so that we can safely protect our people. Thank you all, and God bless. Stay safe, Mississippi.